topic that always shows up on the PTCE, verifying a DEA number. Okay, verifying a doctor's or a prescriber's DEA number. Okay, at the end of this, the last slide, this PowerPoint or presentation, there's going to be a knowledge check like always, and it's very similar to how PTCB asks the question on the PTCE. You'll have A, B, C, and D. Which amongst this DEA numbers correspond or is valid? And this is the name of the doctor. Okay, but before we start, I summarized this whole topic into 3 steps. Okay, because I don't want you to, like I said, I like simplifying things. Okay, so first things first, what does DEA stand for? It's not agency. Drug Enforcement Administration, common mistake. Okay, so go to their website, you will see what I'm talking about. DEA stands for Drug Enforcement Administration. Okay, so common mistake. People will say agency, it's administration. Okay, who are they responsible? What are they responsible for? Narcotics or any substance that has the potential for abuse. Not only drugs. Okay, any substance that has the potential for abuse. Who do you think made the schedule or the controlled substances schedule? They did. C1, C2, C3, C4, and C5. Okay? They scheduled that based on potential for abuse. You have to remember this controlled substances, C1, C2. I'm not going to draw the whole. We're going to do that later on. I'm not going to draw the whole table. I usually do. But just as a quick recap, okay? The lower the number, the higher the potential for abuse. C1 is more addictive than C2. C2 is more addictive than C3. C3 is more addictive than C4. C4 is more addictive than C5. Okay? DEA is responsible for the scheduling. Back in the day, there are drugs. They can change the schedule of specific drugs. Say, for example, tramadol back in the day is not controlled. Now it is. Okay? Hydrocodone, because it's not a true opioid. Okay? Hydrocodone back in the day is C3.
So overdose.
Now it's C2. So both back in the day, oxycodone is 2, hydrocodone is 3. Now, because of the abuse that people are doing, oxycodone and hydrocodone are under C2. Are you following? So it's DEA. They're the culprit. Okay? This change, okay, because they're seeing abuse. But just so you know, in other countries, all this oxys are illegal. Okay, that's why we're the only country that has the opioid epidemic problem.
Like about how often do they do some type of audit, like every year, every?
There's no specific timeline for like, okay, they just see what's going on, and there are numbers, there are reports, like we need to change to this. Okay, people abuse tramadol. Okay, so we need to make it controlled. Soma used to be C4 for all. Now Soma is C4 for the entire United States. Soma used to be C4 first here in Nevada. It depends. Remember, when state and federal laws differ, who do you follow? The more stringent. In that case, back in the day when Soma was C4 here in our state, but not in other states, which one do we follow? Our state laws. Are you following? Okay. So that's another 1 point for your PTCE. When state and federal laws differ, always show up. Okay. You follow, the answer is whichever one is more stringent. Okay. C1, C2, C3, C4, C5. Just as a summary. C1, street drugs. Okay. No approved therapeutic effect. So these are still illegal, including marijuana. Okay, though many states approve marijuana as legal. I'm not going to deal with that right now. I'm just focusing on this. C2 and C3 are usually for pain, your pain management. C4 and C5 are usually for sad. Good job. Okay, what's sad?
Sleep, anxiety,
I'm going to talk about specific drugs in pharmacology, not right now, just so you know. Okay. But here are the ones that always show up, and you want to have it on your notebook. Okay. Anabolic steroids always show up on the PTCE. What do you think? Anabolic steroids? We did the sequence one. No. Anabolic steroids fall under C3. I said this sequence one, remember? It was also a question on your board, on your final exam. Soma, I just mentioned it. C4, okay? Your benzos. C4. Okay.
Why does the anabolic steroids fall under 3 instead of 1?
You remember? You guys remember my story about anabolic steroids? How it started?
I thought it'd be 1.
Remember, steroids are anti-inflammatory. Okay, they used it back in the day. It was only used in animals. Yeah, horse racing and stuff. And then bodybuilders realized, I might do that too. I'm gonna have that stamina. Remember the horse race I was talking about? They'd shoot up the horse, even if they have fractured legs already, for them to finish the race. Okay, so bodybuilders saw that, oh, okay, if I shoot up steroids, then, well, they classified it as S3 instead of non-controlled.
Makes more sense.
Okay, so you can still get anabolic steroids. Okay. Quick. Okay, now let's verify. Let's check for the validity of a doctor's DEA number. But before we do that, who do you think can prescribe controlled substances? Okay, only the doctors or prescribers with a DEA number. Who has DEA number? Okay, not only prescribers who can prescribe DEA numbers, but also pharmacies or institutions that carry controlled substances. So hospital care controlled substances, they have to have a DEA number. Okay, hospitals carry controlled substances. The distributors of these drugs. Okay, if you keep in your facility controlled substances, you must have a DEA number. Who are the doctors though? They're not all doctors who can prescribe. They're not all MD. Okay, who can prescribe controlled substances. Nurse practitioners, as long as they have a DEA number, can do that. Who else? Chiropractors. What did you say? Dentists. Okay. Who else? PAs. As long as they have a valid DEA number. So we will check the validity of DEA numbers. Who else? Psychiatrists. Psychiatrists are real doctors, just so you know. Okay. Okay. But your therapists are not like doctors. Okay. So therapists, if they have DEA numbers. Okay, now let's check for the validity of a DEA number because this always shows up on the PTCE as well. Oh, summarize it into 3 steps. Okay. I did make this PowerPoint, so I'm gonna redo this whole thing. Dr. Anchovy, a couple of things. First, you do the pre-qual. Okay, the prequel would be, is the first character A, B, usually this for M or F. That's the prequel. Okay, A, B, M, and F are the most common. A, B, M, or F are the most common. Okay, usually A is a prescriber is working in a hospital or in network in an insurance company. B is private practice. M and F are not very common, but they show up. What does this mean? Well, how I remember M, this is not the actual meaning of this, okay? But this is how I remember it, okay? M are medical practitioners, not necessarily a doctor. Okay, and then the F You usually see this in the military setting. They're not doctors. They may be trained on certain medical practice, but they're not doctors and they're allowed to prescribe. And so, F is commonly seen in the military setting. Okay, when you're in war and there's no doctor, what are you gonna do, right? Like when you're deployed, there's no doctor. So there are military men allowed to prescribe. And this is when you usually see the F. And so I tried to remember that as federal. That's not the real meaning of it. I'm just trying to remember it that way. So M, usually you see this with dentists because they're not MDs, okay? Those are the medical field, but not necessarily doctors that are allowed to prescribe. That's your first qualifier, okay? The second qualifier is the next character must be the first letter of the doctor's last name. So check, right? And then here's my 3 steps. Forget this, okay? Listen to this 3 steps I'm going to do. First step would be to add the first, the third, and the 5th digits. It happens to be 7 plus 9 plus 5. That's the first step. First, third, and 5th. You follow? This is my 3 steps. That's why I said, forget this. Don't look at this. Okay? I'll simplify it. 7 plus 9 plus 15 is? Let's put 21 here. Second step. And this is the reason why I summarized it into 3 steps. So you don't forget this step too. Second step will be to add the second, the 4th, and the 6th digits, which happens to be what? 1 plus 2 plus 6 equals 9. But I made it this way so you'll never forget that step 2 should be times 2. Okay, so this is 18. And the third step is to add the first step sum and the second step. So 21 plus 18 is 39. And this last digit should coincide the last digit of the doctor's DEA number. I made it this way for a reason, so that step 2, you never forget to multiply it by 2. Yes.
You always have to multiply it by 2?
Yes. Yes, that's why I said, forget this. I'm going to give you something, and I summarized it so you'll never forget that step 2 is to multiply it by 2. So I said, forget what's written on your packet. Look at this. Simple steps. After you do the pre-qual, do the 3 steps. There? Not that hard. Okay. These are just some of the codes. There's more than A, B, M, and F. Hospital or clinic physician, right? You see this B. Okay. F can be distributor too, but I've seen this in the military setting. You don't have to know this. Okay? You don't have to know this, okay? I just know that A, B, M, and F are the most common. Okay? Did you see M, how I remember it? Medical professional, not necessarily a doctor. It's coded as mid-level practitioner, NP, PA, the lights. Now, knowledge check. This is on you. So we have here 6 doctor names. You have to verify which one or ones are valid DEA numbers based on how you learned it, and which ones are not valid DEA numbers. On the PTCE, there'll only be 4. Okay? There'll only be 4. So what do? You cross out the ones that don't answer the pre-qual right away. Right? So A, B, they're A's and B's. There's an L, okay? What's the doctor's last name here? Hale. So this can be, right? Baker, this Candy, Smith's Candy, DeMarco. This one is definitely a no. See that? Okay, now keep going.
How can you read these when it starts with Oh, wait, no, sorry. I'm messing myself up.
Okay. You guys work on it. Remember the 3 steps? Add the first, the third, and the 5th digit. Second, because you did the pre-qual already. Okay. Add the second, the 4th, and the 6th digit, step 2, but do not forget to multiply it by 2. And then third, add the 2 steps together, whatever the last digits should coincide with the last digit of your DEA number. Yeah, this is how they ask the question too. Which amounts, but there'll be only 4. Okay. Yes, Steve.
Question, why do we have to do?
They want to test you whether you know that this DEA number is valid. Because if it's not a valid DEA number, they're not supposed to be prescribing controlled substances.
All right, if you come up with that certain number,
You can come up with one, right? But there's a database for all legit DEA numbers. But this is a common question on the board exam.
I understand.
In practice, you can just look up DEA numbers, MPI numbers. But on tests, they wanted you to know if you know how to verify the validity of a DEA number. Yeah, no one can stop anybody from just creating a DEA number that suffices these rules. Yeah, but there's a master database. Why is it a favorite question? Well, ask the PTCB
Is there a
and the
certain
ExCPT. Yes, that's how it is. That's how they did it. That's the format. What you should be doing is to testing each one. We did the first qualifier, so we know that number 5 is not a valid DEA number. Okay? Because it didn't satisfy the pre-qual that we did. A valid DEA number? I mean, 1, a valid DEA number? Who says yes? Hands up. Okay, I'll put a check here, huh? We'll see. Why are you not working on it?
I'm still confused.
Do you know the 3 steps?
I understand. all
Then do the
steps.
3 steps.
I understand all the steps. It's just, how do you know it's the correct number? Because I don't have a number to know if it's wrong or right.
How do you know the number that's written here? So you have to check it based on the steps I said. Step 1, add the first, the third, and the 5th digit. Step 2, add the second, the 4th, and the 6th digits. I summarize it this way so you never forget that step 2 is multiplied by 2. Step 3, add the 2 together. The last digits should coincide with the last. So you really have to do the math and verify each one. So again, who said number 1 is a valid DEA number for Dr. Nathan Hale? Okay, almost everyone. Are you guys done with 2? Yeah. Okay, so 2, Dr. Timothy Baker with a DEA number BB1013882 who says this is a valid DEA number. You guys on 3? Who's done with 3? Okay, let's wait for a few more. Yes. Dr. Iron Smith.
Oh, I get it.
Okay? Is Iron Smith AS 11611152 is saying that, are you saying that Iron Smith has a valid DEA number? He said yes. Okay. Do number 4. Again, on the PTCE, there's only 4 options. Okay. Daniel, can you see you want to come closer? Dr. Beverly DeMarco, BD 5694267. Valid DEA at number or not? No, you said no. Let's try why not. Be a dissatisfied or prequal, right? Okay. So add a first, 5, first, third, and fifth. 5 plus 9 plus 2 is
14.
16. Okay. Add the second, the fourth, and the sixth. That will be step 2. 6 plus 4 plus 6 is 16. What's my? There you go. You see why I summarized it this way? 32. Step 3 would be, what's 16 plus 32? 48. 8 should be the, didn't go inside. So no. Okay. Last one, Dr. Dippy do right. AD 1414147. Yes or no? A valid DEA number. Okay. Let's check the correct answer. Good job. You got another point on the board exam. Or maybe 2. Sometimes they did 2 or 3 questions of this. That easy, right? Okay. Any questions? Another 5. It's 9:09 on my clock. I'll count it as 9:10. Come back at 9:15. 5 minutes to breathe. Yes.